Hello, everybody. Welcome to Transition from Pediatric to Adult Care session. Thank you so much for coming. My name is Emma Rothman. I use she, her pronouns, and I am a heart transplant recipient of 12 years. I'm so excited to be here because I'm so passionate about this topic that I wrote about it in my new memoir that I published, Things My Therapist Doesn't Want Me to Say, 10 Years Post-Heart Transplant. I will be your moderator today, so if you have any questions, please leave them in the chat or message me privately, and I will ask them for you at the end of Maria's presentation. Today, we are joined with Maria, who is an internationally renowned researcher in pediatric complex healthcare. She has dedicated her professional life to identifying the best practices to prepare patients and caregivers of pediatric transplant recipients for an optimal and a healthy adulthood. Maria is also a transplant mom to her son, who is now an adult transplant recipient. It is now my pleasure to introduce Maria.
Thank you, Emma. Thank you for having me. It is truly my pleasure to speak with you today. I do hope that I give you some information that is useful and some of the lessons that I've learned in this field. When I started to work in this field, my son was a teenager, and I was trying to figure out, how am I going to raise this young man to take care of his health and make sure his transplant is not lost? And even though I'm a nephrologist by training, and even though I knew all the consequences of not taking your medicines, it was very difficult for me to share that information with my son. So I hope I'm able to create some thoughts in your mind and give you some ideas on how to go about this. I'm going to share my slides. I have a lot of training and I have many degrees, but nothing had prepared me to be the mom of my son, Ted. And I started in this field of healthcare transition since 2006 or so. And a lot of what I have learned and published has been really lessons of the field. I have a laboratory and I have international collaborators, and I will share some of the data that we have learned during this time. Let me see, there you go. So today we will discuss what healthcare transition is. It's a process, preparation and healthcare transition as a patient safety issue. I'll share some of the lessons from the field. I will share some of the predictors of healthcare transition readiness and the role of caregivers and providers in healthcare transition preparation. I'm having difficulty advancing my slides for some reason. As I mentioned, healthcare transition preparation is a process, but how do you get from this age on the left to this age on the right successfully? And why is it important? Where does one start? When does one start? How do we do it? Who does what? And what do they do? Transition is not a scary thing. And there are many things that patients have to learn. I know the audience is not just kidney transplant patients, but patients with other organs. I'm sorry to be a little nephrocentric, focusing on the kidney because that's my area of expertise, but I do serve patients with all other organ transplants and all other chronic conditions. But taking, for example, chronic kidney disease, patients have to learn at the bottom, what caused their disease. We as physicians and patients also have to be concerned about growth and development, sexual development, in our case, bone and mineral metabolism, anemia, endocrine dysfunction. We have good nutrition, the effects of having kidney disease and uremia, and of course the psychological aspects of getting into adulthood from childhood. So it is a process. It doesn't happen overnight. And what we have learned, based on one of the tools we developed, the Transition Index, and following 10 years worth of data on 862 patients at the University of North Carolina, we've learned that patients who are 12 years of age can actually learn and handle the important aspects of taking your medicines, adherence to treatment. And they can understand figuring out who's going to help them when they are adults. How are they going to get ongoing support? By ages 15 and 16, patients are able to manage and learning about their name of their diagnosis, the names of their medications, their special diets if they have them. By 17 and 18 years of age, patients report that they understand the importance of trade or school and why is it that they have to learn about insurance, for example. Then at age 19, issues of reproduction come in front. But look at the last bar, the purple bar. By age 20 and older, it's finally when patients learn to self-manage their disease. So they don't develop the skills in adolescence in our cohort. 10 years worth of observation. In our programs and in all programs, there should be a graduation handoff. The patients in the middle, I am on the left side of your screen, and our adult provider receiving my patient is, having the handoff. So I'm telling this adult-focused physician, listen, here's the patient. I grew this patient up. I helped. It's your turn, right? It's a happy moment. It shouldn't be drama that, oh, we're leaving the pediatric practice, and oh my gosh, they're not going to have a play therapist, and they're not going to have a warm team. No, it's a happy event. The patient survived. It's a graduation event. There should be no drama. What happens if patients are not prepared? And this is I come to the safety issue. Patients who are not prepared can be at risk to lose their organ. This is a study in England and the US. They could be at risk for death or graft loss in Canada in 2012. If you have diabetes, for example, higher hemoglobin A1C levels, or if you have rheumatological conditions, higher arthritis activity, for example. But you could change the names of any other conditions, and the issues are the same. It's bad if you go to the adult focus services not well prepared. I will share some of the data that we learned based on the tools that we've developed. We have the transition index and we have the STAR questionnaire. I don't have time to tell you about these particular surveys, but they have been developed with exquisite survey development techniques. It took us 2 years to develop both of these surveys. And we have data that we follow longitudinally based on their measurements that are also guides interventions. I'll mention the START Passport very quickly, and I will mention the All You Need Is Love education media, the Kidnopedia, Planet K, and Planet Type 1 Diabetes mobile apps, and the Kidney Guru. Before I go any further, I would like to bring this slide to your attention. This is a study that was done by the NIH, and they looked at 10 years worth of data on 13 patients, and they looked at their brain scans. Forgive me for making that change. And they were trying to figure out how does the brain look like over time. And here we go, over time. And we have learned based on the study on the upper left-hand corner that at age 5 years, the brain is not totally populated. You see, there's not a lot of blue in those brains at 5 years. But if you look at the age of 20, the brain is almost fully populated. You really become an adult at age 25. And the part that develops at the end is the part in the forehead, in the frontal lobe. And that's the part that controls impulse controls, abstract. You become an adult. And so you don't achieve brain maturation until you're about 25. These are healthy or typical brains. These are not brains of patients who have chronic conditions. So imagine our patients that have chronic conditions and have some cognitive impairment, right? So our adolescents are dealing not just with their diagnosis, but they're also dealing with a brain that is not fully mature or fully populated, right? What else have we learned? We have learned, this is for parents, certainly, that the younger the patients are diagnosed, the less able they are to manage their disease and be self-activated. But if you have had the disease for longer in your lifetime, like these kids that have been diagnosed at a younger age, it is easier for males to make their own appointments and talk to their doctors. So they are a little bit more activated in that sense, but they don't really seem to manage their disease as well. And the question is it the parents are so used to managing their health that they don't let go as easy? Is it they're afraid? Or is it that the kids were never educated because everybody sees them in the clinic and they go, oh, well, he was diagnosed at age 1. This person should be an expert. And so we don't really make the time, I think, to educate the patients about what they have. I have a long list of publications. We've published over 70 publications in this field so far with our laboratory, but this is what we are learning so far from our laboratory. In terms of, in the left side, adolescents and young adults have barriers for healthcare transition readiness, and we have identified that low literacy is associated with poor transition readiness, lower socioeconomic status, being from a minority background, not performing chores at home. Imagine, this is very important. This is something that parents can do. Giving the patients chores at home makes a patient a citizen of the family. Even if it's somebody in a wheelchair, you can sit them by the dryer and have them sort out the socks. I tell my patients in wheelchairs, I go like, I need your help combating the sock monster because I always look socks in that laundry department, and they get a kick out of it, and they'll come and tell me the next visit, I'm becoming the sock, I'm finding the sock monster, right? Also, if the patients think that they don't have the locus of control, if the patients think that they have no control over their disease, that their disease is difficult to control, then that's a barrier for healthcare transition readiness. In terms of parents, being a parent with a single household, single parent is the problem. Also coming from low socioeconomic background or having public insurance, coming from a non-cohesive family, or having more caregiver burden, they're all barriers for healthcare transition readiness. Now, how are we doing? We have international collaborators, and I just wanted to bring 2 slides with data, and no worry. This is not, I don't want you to spend a lot of time on the data, but I want to show you the difference or the similarities between Mexican adolescents and US adolescents. We're talking 2 totally different countries, right? So we, on the left side, we have learned that the patients with older age at the time of the survey have better transition readiness scores. Makes sense. And are able to manage their disease a little bit better. But there's no difference between younger adolescents and older adolescents in terms of knowing about their nutrition or being adherent to treatment in this particular cohort. On the right side, you see the bars comparing US youth and Mexican youth, both in the upper part, less than 16, in the lower part, older than 16. And you will see that there's really no difference between Mexican youth and USA youth in terms of healthcare transition readiness. So it's a problem that is not just our country, it's a universal problem. The same happens in other countries that we collaborate with using our tools. So we have a lot of work to do across the globe. So the summary is that older patients have greater scores in 6 domains, and that there's no difference between Mexican and US youth in terms of transition readiness by our score. Here's another readiness tool that we've created. This is self-report, the STARX questionnaire. And I want to just focus, since this is a transplant conference, I want to just focus on the transplant patients. Here, the columns are chronic kidney disease, patients on peritoneal dialysis, patients on hemodialysis, and transplant patients. And I want you to know, and just like in the Mexican study, renal transplant patients have better transition readiness simply because we've educated them more, or they are healthier. They seem to have more self-management, more disease knowledge, and can communicate with the provider a little bit better. But I still want you to focus on the bottom row. The highest score is 90, and even the transplant patients, they're barely over 50% of the score. So I'm going to ask a question to the audience and maybe put the answers on the chat. So I asked adolescents over 3 summers, 3 different summers, 3 different groups of adolescents, how do they prefer to learn about their health? And these were the options: written information, other patients like them, internet, health providers, or parents. And I wonder if some of you could answer some of those questions. So here comes the answer. Ready for the answer? The answer is, if this will let me advance. I don't know why this is not letting me. There you go. The answer is parent. This It's correct. This was an eye-opener. It's 315 patients, 3 different summers. Yes, this is a southeastern US survey, but we were in shock when we learned this, because we thought that perhaps they would like to learn from the internet or other patients like them. But no, adolescents prefer to learn about their health from parents more than providers. We also have learned that if patients prefer to learn from their parents, they have better adherence to treatment. Whereas if they learn from providers, they know about their disease more than the rest of the patients. This is a problem because when we looked at transition index scores between parent and youth, they are very similar. It's like parents and children have very similar scores in all domains. So I just want to make sure that you understand how important caregivers are to prepare their patients for transition. We need to delegate, we need to teach them how we manage their health. We need to trust them that they can handle managing their disease. We need to let go, like the song says. This is Ted, my son, when he was in his early 20s. And this is a copy of our transition passport. And it looks like a driver's license. And we take the picture of the patient and we put their diagnosis on the right. But we not only put their medications, the names, how much they take, but we also write why they take those medicines like tacrolimus and MMF to make your kidney happy, right? Another tool that we've developed is All You Need Is Love. I mentioned that. All You Need Is Love stands for Adherence and Longitudinal Life Skills for Youth under Nurturing Educational Environment on Disease, Intelligent Self-Management, Lasting Outcomes, Visionary Empowerment Project. Can you imagine me presenting this at the American Society of Nephrology or the International Society of Nephrology meetings? I do present my All You Need Is Love data. But it's a lovely low literacy tool. It's available on our website, which is I believe written in the bottom of your screen, and it's designed with parents and patients input and educators input. A couple of our residents, and one of them was a middle school teacher, so I was very excited to have that residence, Dr. Bryan's input in this. We have All You Need Is Love also in Spanish, and we've tested it and validated in Colombia and in Mexico, and these are the 6 modules that we do in All You Need Is Love. We introduce them to the kidneys, how to manage chronic kidney disease, how to make healthy decisions, how to learn about self-management, how to become independent, and then a review and a quiz. And I have to tell you, their pre and post transition index scores after this educational material happened. And these are young adult Mexicans who did this, helped us validate this tool, All You Need Is Love. We have had some success with Planet K and Planet T1D. Those are video game apps. I'm not going to spend a lot of time. It's expensive to produce them, costs us $250,000, but they dominate the games very fast, and they come, what's next? So it's not necessarily the best proposal, but we do have evidence that participating in this app, the young adult people and the adolescent folks had better transition index. We are now about to launch My Kidney Guru, which is an interacting app for providers and patients. So if you're interested in learning about this, please contact me. I'm happy to show you, have you participate in our study. It teaches adolescents and young adults how to navigate the health system and how to ask questions and interact with providers, as well as transition readiness. I'm going to show you a low impact, very cheap, very, very inexpensive tool to prepare patients for transition, but I am nuts. I'm so crazy about this because this Kidney Clues cards gives the patients, siblings, and parents a voice. Here's an example. When I round in the patients, inpatient, I give them cards because my patients, I don't know about you guys, but my patients never have questions. So the first card on the left, it's a patient who came in, 15-year-old, brand new diagnosis, rapidly progressing kidney disease. She needed dialysis at the time she presented. She was, quote, healthy before she came in, and she was actually college bound with a basketball scholarship. And here she is, 15, now in stage. Here are the cards and the questions that she wrote to me for the next day. Even though I spent 3 hours going over this new life-changing diagnosis, she writes, can I die from this? Can I still play sports? Such an important part of her life. So what can I expect when I leave here? Will I be this way for the rest of my life? Imagine that, right? Well, you leave that, you know this, you don't have to imagine that. Then in the right lower quadrant is the sister's questions of the same child. She was in the room when I talked. She writes, how can this affect her family and the rest of her life? Can she still play sports? Will it get worse? Don't you love this? And then, is it okay to be scared or nervous? So imagine, I'm just so excited about this tool because I'm really hearing their voices, right? On the right upper quadrant, there's a mom question on a new transplant. So exactly how do I know how the program dose is going to be changed? And will we know if the infection from the donor is in the recipient? Then 17-year-old female who really was very worried about the steroids. Will I develop acne problems? For sure. How long will I be on steroids? Get me out of this. And will I be able to do math like I used to? Right? And here's another question. An 8-year-old at the bottom. Is my blood patient, transplant patient, is my blood work good? Is my kidney doing good? Can my brother come see me? So I wanted to share this because I wanted to tell you how important it is for me and for my team to listen to our patients' voices and our children in what they have to say. And there, I want to quote this arts and medicine quote from the University of Cape Town. What do we learn by listening to the voices of children living with illness? Are youth with sickness causes of weakness, or can they become opportunities for transformation? I am so excited to talk to you today. Thank you for inviting me. Our program addresses and takes care of patients who are 12 to 29 years of age at the University of North Carolina in Chapel Hill. I am thankful to my patients, families, and volunteers for having produced over 70 publications in the field. I think we are some of the worldwide leaders in this area, and I'm not being shy or arrogant. I recognize our laboratory work. We collaborate with people across the US and across the world, and we receive funding from these agencies. Thank you so much for having me. I am delighted to try to answer your questions.
So the first question that we have is from an attendee who has a 16-year-old son, and they're asking how they can get them more involved in their healthcare because they're worried that they won't take care of their new liver.
They can. I'm so glad there is that question for this from a patient. I love talking to adolescents and young adults. They're my favorite patients. I think that how you can do it is exactly what you just did. Join and learn about your disease. Come join seminars like this. Ask questions. Bring a card to your doctor's office with 1 or 2 questions every visit, or on telemedicine. You know, I find telemedicine has been an interesting experiment for us, but I have found that telemedicine is not really well liked by adolescents. It is more liked by parents because of their transportation issues. But anyway, at any opportunity that you have to interact with the health providers and your parent, ask questions. There are no dumb questions. There are dumb answers, but never a dumb question.
And would you give different advice to parents who want to know how they can get their kid more involved rather than speaking directly to adolescent patients? Like, what should parents be doing?
Well, parents should be learning about their diagnosis of their child, because they are going to be helping us teach them about their disease, their disease in their child. This is what we're learning, right? The other thing is support group. Parents that are overwhelmed and overtaxed, ask our patients. Supports groups are also very helpful. So I'm glad that you guys have this organization. One other thing, a number of diagnoses that probably are attending here are not very frequent. There are not that many patients in families like ours. So isolation is so big in our communities, but finding support, finding somebody to talk to is a lot of help.
Kind of going off that isolation, I guess, topic, somebody's asking, I would be interested in what access kids have to other patients. Unless they're connected through an outside program, it can be very isolating.
Correct. Well, let me tell you, in the best advice I can give you, at least in our experience, is to ask your provider, your doctor or nurse practitioner or PA, if there's any other patient in their practice that you could connect with. And we do this all the time. We ask permission from both family members and we connect the kids. I'm going to tell you, we had a Facebook group. And early in this transition thing, we had a Facebook group. And it was wonderful because the patients, it formed a nice little group of about 40 patients, and they would chat and they would come visit each other in the hospital. That was very nice. But the problem was that it was labor intensive and it required some policing to make sure that they're not inappropriate postings. So we didn't have the staff to continue that. But it was so rewarding because it was even before COVID, right? It was before all this isolation. It was a Facebook group that really helped the adolescents and young adults with chronic kidney disease and get together.
Hey, Emma, there's a question that was directed to you. I think we would really like to see if you could answer it. It was, what was the hardest thing for you as a heart transplant recipient as you grew into being an adult? Is there anything you wish you had been handled differently by your family and your care team? And is there anything that went really well?
Thank you for that question. I thought it was really interesting, Maria, that your study started with the age group of 12 years old, because that was how old I was when I had my heart transplant. And I think the hardest thing for me was, just like you said, that you kind of have this expectation that because you've had this since you were so young, that by the time you're an adolescent, you're a professional and you know everything that you need to know. So I think in the future that bodily autonomy is so important, and connecting with other people who have been through that experience definitely helped me a lot. The things that went really well were connecting with other communities and finding a doctor who reframed the experience, the transition experience, as something that is like a wonderful achievement rather than something that's really scary. So that was a really powerful experience too, and a really great mentor. I wanted to the last question before we run out of time, your intersectional identities as a caregiver and a mom, what advice do you have for people who either are just starting on this journey or, are kind of feeling that isolation, or what you wish someone would have told you beforehand? Would be, I think, a wonderful place to end.
I think that for parents who are just starting, my advice is you can handle this. This is something that you were given for a reason. There is your child could not be in a better family. And I have that conviction. I was born to do this, and I accepted that as my mission, and is my life mission, which not only extended to my child and my family, but to others. So when I talk about research, it's not research, it's my life mission. And so I want to tell parents, it is your life mission. Love it, embrace it, but learn from it. Ignorance is not a good thing. Go learn, go find out how to deal with it. Because my son was diagnosed at 18 months. I was a medical student, and I was called an overreacting mom. And I kept telling my pediatrician in Austin, Texas, this is not even in Mexico where I was trained, my baby is not growing well. Oh, no, you're an overreacting medical student. So you're not alone. Overreact, be active, be an advocate of your family and your child.
Thank you so much, Maria. And thank you everybody for coming. I know our contact information is also on this platform. So if you have follow-up questions, please feel free to reach out. Please stick around for the next session on sports physiology and transplant, which will begin at 2:00. Thank you all for coming.
Thank you for having me. Bye-bye. Thanks, Emma.
So nice to meet you.
Nice to meet you too. Thank you for what you do.